KOB News 10 presents Dialogue, a weekly public affairs program exploring community concerns and spotlighting regional activities.
And good Sunday morning to you, everybody. Welcome to Dialogue. Throughout the month of December, we focused on grief. We've also focused on senior citizens and loneliness and depression. And we are somewhat continuing that theme as we are prepare to say goodbye to 2025 and hello to 2026. We're talking about our mental health. And of course, mental health issues. We're talking stress, we're talking about depression, we're talking about loneliness, we're talking about holding things in. And I am so pleased to be able to have this dialogue, this conversation with Albany native Dr. Allison Williams. Many of you may recognize her attending high school here in Albany, following the family business in some ways. Welcome to you and thank you for being here.
Thank you for having me. Appreciate that.
Well, let me just say, I have observed you at least two Wellness Expo events hosted by the Albany, Georgia chapter of the Links, where the topic was mental health. And that is when I really got to know you and then connected the dots. I had heard your mom talk about Allison previously. And so when we talk about that family business, your mom is Dr. Stephanie Williams. And was that your inspiration to follow in her footsteps?
Definitely a big part. From shadowing in her office, kind of following her around the hospital. So that definitely ignited the curiosity about medicine.
Okay, so why then, go into psychiatry?
I think psychiatry specifically, I really enjoy getting to know the whole person. So knowing about their medical conditions, obviously, but also kind of learning more about their background, getting more time to speak with them, and just kind of learning how people became the people that they are today.
And issues.
Yeah,
all the things. The deal is, some issues are more intense,
right,
than some other issues. And then there are just your everyday stresses, but they can build.
Right.
And especially this time of year.
Yeah, it's very stressful. A lot of people dealing with just the stress of the holidays, but also kind of what you mentioned, grief and things that are just starting to come back up for a lot of people. So you are in your third year of residency. You received your medical degree from Ross University School of Medicine in 2023. And let me back up. Bachelor of Science in Biology from UGA in 2017. And let me back up. Which high school? Sherwood Christian Academy, class of 2013.
Okay, and so you are pursuing a career in general adult psychiatry following graduation while simultaneously educating your community on the importance of mental health and reducing the stigmas associated with it. So when you talk us through walk us through your residency. Are you meeting one-on-one with patients? How does that work?
So it starts out initially, we're pretty heavy in the hospital, so that's where a lot of the acute crisis are. If people are experiencing very serious depressive episodes or psychotic episodes or substance abuse, that happens there. And then as we progress a little bit more, we get to meet people kind of in the community, so a little bit lower stress, but still dealing with kind of like the everyday depression, anxiety, therapy, medication management, things like that. So we work very closely with patients on a day-to-day.
What about ages? I mean, do you see the full gamut?
Full scale. Mainly for us in general training, it starts at 18 adult, but it can go all the way until, so all age ranges.
Now, the day before we were actually taping this, there was information about a new study that I'm going to share, and then I'd like to hear your thoughts on this. The mental health of many Americans remains a major challenge, and that's according to a new study. A new poll from West Health Gallup Healthcare found that Americans' views of their own mental health dropping. The poll found for the first time adults who described their mental health as excellent fell below 30%. That is a 13% drop over the past 6 years. And researchers say the COVID-19 pandemic appears to be that turning point in how Americans view their mental health. What have you observed in terms of COVID? Do you agree with that?
I would completely agree with that. a lot of things that we focus on in practice is when people get better, they get better because they have a very good support system. And that kind of helps us track if we think, or the rate that we think that people are going to get better. And so we saw during COVID, a lot of that was stripped. Obviously, people lost a lot of family. And if you weren't actively going through loss, then you were isolated from your family because you couldn't gather, you couldn't really talk that much, you couldn't be in intimate settings like that. And so we noticed a lot of people, it took a lot of toll on them, and isolation led to depression, it led to anxiety, obviously also a lot of anxiety about people not really knowing what was going on about the virus and how it was spread, and there was just not a lot of information.
Uncertainty.
So a lot of fear and uncertainty too.
Well, we sort of, did some communication back and forth about different things we wanted to touch on. First of all, when you say you want to educate your community about mental health issues, we can go back. It was taboo to say or to express a need for help or to sit and talk with somebody. That was not the thing to do. Talk about the changing times.
I think things are definitely changing for the better. I think there has been a lot more discussion on social media, and while I have some mixed feelings about the use of social media and mental health, I think that one thing that it has done is create a platform for people to be open and realize that there are a lot of people dealing with the same things, and therefore it lets people come forward and seek help a little bit easier than maybe before, especially when I have a lot of people saying, that wasn't really discussed in my household when I was growing up. So they didn't really know how to approach it, But it's getting better.
It's getting better. And so in your settings, I asked you previously, you work one-on-one, but are there also group settings?
A little bit. We do offer some group therapies. I'm not directly involved in that, but I have seen that people do find a lot of community in those group therapies, and they find it to be very helpful. So I think both individual and group are equally as important.
When we talk about those taboo topics that we didn't talk about, if you felt a certain way, whether it's anger or either sadness or whatever, we were suppressing. And now, and that's also, you say, a way that people survive by keeping it inside.
Right.
Also, I can tell you it leads to ulcers. Been there, done that. Yes.
So yeah, a lot of people feel that they kind of going back, they don't feel comfortable talking about it, and so, or they think that it's just normal to feel certain ways, and they just keep it inside. And sometimes that works. It helps you just get through the day to day, but I think that people don't realize the long-term effects that it can have as far as keeping things in, and it can lead to worsened mental and physical health. So I think it's important that we do start addressing things sooner than later. Well,
we need to take a break, but when we come back, we're going to talk more about disparity, the disparities of access to mental health services. Also, going back to that stigma, we're fearful of being judged, whether it's by our family members or by our friends. So stay with us as we continue our conversation about mental health as we are bridging from 2025 to 2026. Stay with us. Welcome back, everybody. We're still talking mental health on this Sunday after Christmas as we're getting ready to say goodbye 2025 and hello 2026. Still talking with Dr. Allison Williams. She's a third-year psychiatry resident with a clinical interest in general adult psychiatry. Now, during the commercial break, and I'm going to go back to the disparity, but we started talking about the youngest patient you see is 18, and then it goes on up.
Right.
Talk about the difference between the health issues that an 18-year-old might face versus that senior citizen.
Well, in the teenage to, I guess, young adult 20s, we see a lot of patients who are dealing with just kind of that transitional period, not knowing what they want to do in life, or maybe having an idea of what they wanted or thought they wanted, and then getting out into the real world and things are a bit different than they expected. So just a lot of pressure.
We use this term, in the newsroom, so it's not to offend anybody, but adulting.
Yes,
adulting. Okay, right? You're having to learn how to become an adult.
Right.
And that can bring on stress. Now, I guess my question is, all of us who are older had to go through that.
Right.
But I just, you know, it didn't inspire most of us, I don't think, to have to seek a counselor.
Right.
So what's different?
I think there's just a lot of outside pressure, a lot of new factors that have come in as far as comparison with peers, and now they're exposed to a whole different, I guess, class or category of peers, because it used to be, you know, just maybe your classmates or your neighbors, but now you have access through social media to all of these different people and influencers who a lot of people feel that they are comparing themselves to, or feel like they should be in a position that their favorite influencer is in, or making as much money. And then it produces a lot of negative self-talk, self-worth, self-doubt. So I think that has significantly impacted people in that age range as well, along with the normal pressures of adulting.
Okay, and then when you go up in years to the seniors, what are some of the issues that you hear from them?
Some of the things that we talk about is more so about, obviously, focusing on end-of-life things, kind of realizing that they are getting older, new health problems that they're experiencing,
aches and pains.
And the number one thing I think is loss of independence, or loss of your previous life, where now you're having to depend on other people for things that may have seemed simple before. And that takes a lot of toll on them as well.
Well, I will tell you, in all honesty, and this was recently, I was thinking, and I've heard other people say this, that you have lived, you've lived for us, you've lived most of the life, and you've got less life to live than you've already, there you go,
right.
Than you've already lived. So that, I mean, you start thinking about that,
like that, yeah.
And how, I had a conversation recently with somebody, and you know, you're making choices that work for you, you know, to take away some of the stress. I call it kind of transitioning,
right?
Whereas you used to say yes, 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 and then all of a sudden you're not as young as you used to be,
right.
And again, those aches and pains, and you're just like, you got to slow it down.
Yeah,
you know,
exactly.
You've got to slow it down. Let's talk about disparities now. What research is there? Research that you have studied in terms of access to mental health services? So, if you need mental health services and you are a minority, for instance, how does that compare to other people who might need mental health services?
We've definitely noticed that there is a gap as far as access to care, especially in the region that we're in. And it sometimes just comes down to cost, but also availability of providers. A lot of providers are, choosing to go to more populated urban areas, and that kind of leaves the suburban and rural areas to either have to do telehealth, which isn't inherently bad, but a lot of people do need that one-on-one personal attention, and they're just not able to get it. So there's a lot of things that kind of contribute to the disparities, especially in the South.
And again, going back to the culture, so, and I'm sure that you still hear about cases where, well, that's just not something my family wants to hear me talk about.
Right. So, like I said, getting a little bit better, but definitely have noticed that, especially with certain minority populations like Black people and Hispanic people, who have just said that's just, we had other things we had to focus on. Survival wasn't really about your mental health. It was about making money. It was about having
feeding
clothes,
your family.
Food. So nobody was, even though the problems are still there aren't really new problems, but it's just not discussed because at that time that wasn't at the forefront of what was deemed to be important.
Well, not only the stigma piece of it, but what about the fear of being judged? Right. That you're not strong enough. You're supposed to be strong. And I'm thinking mainly males when it comes to that. A real man don't cry. Real men don't go and sit down and talk. That used to be the train of thought. What about now?
I think there is still some element of that as far as the different genders, because I still definitely do see more women than men at this time, but some men are starting to say, like, just the impact of having to be the providers and having to work and then not really having anywhere to open up emotionally. It does take a toll on them. So there is still kind of that divide as far as the the populations who seek the help, but I think it's 50-50 as far as who's experiencing it. So I think that there's definitely still some room to grow with that aspect.
You mentioned earlier about telehealth. Are you also engaged in telehealth with some of your patients?
Yes, I think it's a great tool. Usually, first off, seeing them, I do like to see them in person, just because, as I said before, I do like to see the person as a whole and see what all they're experiencing, if they are having trouble walking, if they are having any like physical concerns. But I think telehealth is a great way to reach people who might, again, not have the access to come in and out of a city or things like that, so that they can still get the care and they can still get medications, even if they're not really within reach of us to be able to see us physically.
Now, I know I may be putting you on the spot, but I'm just thinking, you know, after graduation, any ideas about where you would go, or would you come back to Southwest Georgia, or have you been putting any feelers out there?
I'm open to it. I have some feelers out there, so I don't know exactly where I'm going to end up yet, but I am open to the idea of being within the Albany community, definitely in Georgia for sure. So I plan to be very much within reach.
All right, we need to take another break. When we come back, I want to talk about integrating faith and therapy, because again, there has been that train of thought over the years that, hey, you got God, God's going to fix it, and he will. But God has also empowered people to be angels. Okay, I call you an angel to help us get to where we need to get to, right? So we'll continue our conversation with Dr. Allison Williams when we come back. Stay with us. And welcome back to Dialogue on this Sunday after Christmas. Again, getting ready for the new year. And so do you have any stresses, any anxiety from 2025 that you may be taking into the new year? Maybe you need to sit down and just talk with somebody one-on-one about that. I'm talking with Dr. Allison Williams, who is a third-year psychiatry resident with a clinical interest in general adult psychiatry. Of course, Albany, Georgia native, and her mom is a physician, and full disclosure, she's my doc, you know, so it's in the family, it's in the family. But let me just say this, okay, when should somebody seek help? I mean, like I said, I'm talking about the stresses, the end of the year stresses, and you're just feeling overwhelmed, or the beginning of the new year and like, oh my gosh, how am I going to handle this? When should, what is the trigger that somebody should seek help?
I think it's when you start feeling less like yourself. If you're noticing some changes, if you're noticing sleep patterns changing, you're noticing maybe you're not eating as much, or things don't feel as enjoyable that they used to. If you're starting to feel any of those things, it could be a sign that you might be falling into a depression. And so I think it's important to kind of recognize early patterns so that you are able to see someone earlier on or talk about some issues, so to prevent further progression into depression or anxiety. So whenever, if it's a day-to-day thing and you start, but you still feel like yourself at the end of the day, you might be tired, but you still feel like you. I think it's important to notice, just check in with yourself and see what exactly is changing. And if you don't really see it getting better, then that's when you need to talk to someone.
Now, what about the family dynamic? Do you, counsel families as well?
I personally don't counsel families, but we do recommend and refer people to family therapy, especially when there's a lot of different moving parts, like if there are children who are experiencing like mood disorders or seemingly acting out a little bit more, then we try to get the whole family into therapy, because usually there's a bigger dynamic going on. And if the child sees that the adults are working together, then that makes them a little bit more susceptible to work within the family dynamic.
Okay, let's talk about integrating faith and therapy, because as I mentioned when we went to break, God, you pray to God to help you get over whatever this is, but there are some people who say God alone can fix it, and yes, he can, but again, he gives us people. That's why we have doctors, that's why we have lawyers. He has empowered them to help us in our daily walk. And so you are empowered to help people with whatever mental health issues they might have. So what about integrating your faith and your dependence on God and therapy?
I think that used together, it can be more beneficial together than it can be apart. As far as going to church, having the community, having the faith, having belief in something that is greater than you, I think that's important because it gives a sense of hope and also purpose. But also not seeing mental health or mental health disorders as a moral failing. Sometimes people think like, oh, it's because I'm not praying enough or because I don't have enough faith. And I try to just counsel people through that. Like there's, that doesn't really mean one or the other. You can be experiencing this and still be very active in your faith. So it's important that we try to encourage people to see it as not one and the same. If you are experiencing depression, it's not because you don't have a certain amount of faith, you're not as Christian or whatever it is that you're practicing, but to still hang on to that faith because it does give you that sense of hope and purpose and something bigger to kind of attach to, but also still while working through whatever challenges that you are. And so I encourage people to use both the doctors and therapists at your resources, but also having that the backbone of the faith in the church.
Well, I was, as you were talking, I was thinking about earlier when we were talking about the stigma. If you are a sports fan, or and so I'm thinking about football players, I'm thinking about Olympians and all of those highly competitive sports activities, a lot of them have therapists. A lot of them seek help, mental health, and it's about getting over certain maybe barriers or whatever, and it's not, don't do that. You don't hear that. They're encouraged to do that.
There are actually, it's kind of a new area of psychiatry, it's sports psychiatry for athletes who transition from maybe like college athletes specifically who might not be pursuing professional careers in sports because there is kind of like that loss of identity. Because when you're in college and in high school, you're praised for all these athletic talents and abilities. And then as you move on, people aren't really paying as much attention anymore. You aren't getting as much of the praise, and a lot of people's identity is tied into the sports and the achievements that they were able to accomplish while they were athletes. So there is a field now opening up specifically for athletes or to counsel athletes kind of through those transitional periods.
And the other transition is maybe from college to the professional level, because what about the pressures that professional athletes face? I mean, for instance, having all that money, and maybe they had not been taught to budget or how to protect themselves, from everybody that's out there grabbing.
Exactly.
So I would imagine that's a need too.
Right, there is. And just again, kind of what you were saying, the money that comes with that, but then all the pressure and the people who start popping up and just how to kind of deal with all of that and not really losing sight of yourself in that transition as well.
All right, well, I want to say thank you and Merry Christmas and Happy New Year to you and your family and everybody out there. Thank you so much for being with us throughout this year. Again, December has been a month where we're just talking about some real life issues and hopefully some of our dialogue, some of our conversations have been helpful to help you bridge from 2025 on to 2026, praying that it's going to be a wonderful year for you and your family. Mental health, it is important, and it's okay to talk with somebody. Have a wonderful Sunday, everybody.